bills that have been put over. One is SB 524 by Senator Correa on solid waste having to do with auto shredder residue. And the other is SB 744 by Senator Strickland on requirements for clinical laboratories. So those bills will not be heard today. And also, one more bill put over for 1 week, it will not be heard today, is Senator Hollingsworth, SB 583, having to do with sex offenders. Those three will be heard next week. So we will begin as a subcommittee, and let's see. Senator Semidian, are you here? Senator Ducheney? Senator Ahlquist, I think you're up first again.
Thank you, Madam Chair. I'd like to take SB 338 first. I have my mayor of San Jose, Mayor Reed, here.
That's fine. SB 338. Welcome.
SB 338 would have a general fund cost of lost tax revenue of up to $14 million annually based on a BOE estimate that uses a static analysis to determine initial revenue losses to the state. It would provide financial assistance to California's renewable energy manufacturers so that California can compete against other states and nations that provide financial assistance to attract California manufacturing facilities. Specifically, it would expand an existing program in the Treasurer's Office to provide a sales tax exemption for investments in equipment used to produce renewable energy such as solar, wind, and fuel cell energy. Because the BOE uses a static analysis, its fiscal analysis does not include the potential revenue generation of this bill. Also, the BOE analysis presupposes that renewable energy investment would come to California without incentives created by the bill. Let me tell you that this is not the case when other states and nations are aggressively recruiting California-based renewable energy companies to move their manufacturing out of state. And I have witnesses.
Thank you, Senator Ahlquist. Good comments. We'll go to the mayor. Good morning. And tell us your name, sir.
Good morning. I'm Chuck Reed, Mayor of San Jose.
Welcome.
Thank you for inviting us in. I'm here because of the tremendous opportunity that California has to capture great job growth in the clean technology market. Right now, there are probably half a dozen San Jose clean tech companies that would like to expand, a couple million square feet of expansion space for thousands of jobs. Eventually, they're going to expand. But the question is, will they do it in California or will they do it in other states? We suffer from two problems that this bill would help correct. The first is the difficulties in the capital markets that make it virtually impossible for these companies to get access to capital for expansion. And the second is the fact that our sales tax is applied to their investment in manufacturing equipment if they want to use it in California. I know that each of these companies really wants to stay in California, but they are looking at every other city, every other state, and every other country in the world as opportunities for expansion. And the question is, will they do it here or will they do it elsewhere? We have the opportunity to create thousands and thousands and thousands of jobs in California, as Silicon Valley has done in the past with clean technology. This is an opportunity for the entire state. This bill will help us be more competitive to keep jobs in California for companies that otherwise wouldn't be here. I'll give you one example. NanoSolar is already a company manufacturing in San Jose. Yes, manufacturing solar panels in San Jose, the world's lowest cost solar panel. Their entire production capacity is sold out for the next 4 years. They would like to expand. They would like to do it in California. Right now, they're not going to be able to do it in California. This bill would be a big part of the resources necessary to keep them in California. So that's why I'm here. It's all about jobs for California. I'm joined here by the City of San Jose's Chief Development Officer, Paul Krutko. He's available for any questions on any technical basis. We've looked at the tax revenues that would come to us and the state. Aside from the sales tax issue, there's, of course, lots of other revenues that we would all enjoy that would more than pay for the cost of this if you do a dynamic analysis.
Thank you. Thank you, Mayor. Appreciate your comments. You're here to answer questions?
Yes.
Is there any other testimony in favor? Is there any? Okay, one more in favor. If there's any opposition, you can get ready to speak.
Chris Rosa, representing Applied Materials in support.
Thank you.
Diane Stanton, State Treasurer's Office in support.
Thank you. Any other testimony in favor? Is there any opposition? Finance, do you have a comment?
We do not have a file on this item.
Senator Alquist, wonderful concept. There are cost pressures involved. We'll discuss it when it's on suspense.
Thank you.
Thank you. We will take up. We'll call the roll and establish a quorum, and then Senator Alquist's
Thank you.
item 338 will be moved to suspense without objection. Call the roll, please.
Kehoe?
Here.
Kehoe here. Cox? Here. Cox here. Corbett? Here. Corbett here. Denham? Here. Denham here. DeSaulnier? Here. DeSaulnier here. Hancock? Leno? Here. Leno here. Oropeza? Runner? Walters? Here. Walters here. Wolk? Wolk here. Wyland? Yee? Yee here.
We have a quorum. Thank you, members. Senator Alquist, item 338 goes to suspense without objection. Would you like to take up SB 56?
Yes, please.
Go right ahead.
SB 56, and I understand this bill is a candidate for suspense.
Also, yes.
SB 56 allows health plans that are governed or operated by counties or county commissions to form joint ventures to provide health insurance coverage to individuals and employers beyond the Medi-Cal and Healthy Families clients that they currently serve. Fiscal effects, Department of Healthcare Services says that it would cost $450,000 to hire 8 new staff in the first year in order to administer the program, and then $900,000 annually after that. The 8 new staff seems excessive, if I may say that respectfully, and the identical bill came out with your committee analysis last year with 1/3 of the cost, which was $162,000 in the first year, or $325,000 in annual costs.
Senator Alquist, there's staff notes on the bottom of page 2. The bill doesn't specify into which account or private funds would be deposited for this purpose. Are you going to clarify that, or? All right.
Yes.
So you're working on that. Okay.
Thank you.
Very good.
And we're happy to work with you.
Thank you. We'll go to testimony in favor. Mr. Pallot, welcome.
Good morning, Madam Chairwoman and members of the committee. The author have been very clear on the different bills relative to the cost, and we agree with the author, and we look forward to working with the committee and the committee staff to see how we can deal with the costs in order to move the bill off the suspense calendar. It's a very important measure, and we ask for your strong support of it today, as well as to bring it off the suspense.
Thank you. Next, please.
Madam Chair and members, Emily Clayton on behalf of the California Labor Federation in strong support of this, and just a couple of notes on the fiscal impact. First, as the author has noted, this is a significantly higher cost than this bill has previously been tagged with. Second, I would note that as the bill actually specifies that there will only be funded if there are private funds identified to run this program, and we think that should significantly mitigate the costs. And finally, as to DMHC's estimation of $100,000 to license each joint venture and cooperation between joint ventures between counties, these are counties that already have their own licenses to operate independently, and they could be seeking joint licensure, which we think wouldn't necessarily cost the full amount as if you were creating an entirely new license, and we think that those costs could be diminished by considering that aspect as well. We urge your strong support.
Thank you. Next, please.
Madam Chair, members of the committee, I'm Gary Passmore with the Congress of California Seniors. We have been in support of this concept and are in support of this law. This was part of the omnibus healthcare reform package considered by the legislature several years ago. And like the author, we are highly suspicious about the number that's attached to this. We think it can be done and will be done much less costly. And we urge your aye vote when it comes off.
Just to the witnesses in favor, and to actually all the members of the public that are joined here today, the committee looks carefully at the author's proposals for funding on each bill, and they're highly scrutinized and accurate to the best of the committee's abilities, which I think are outstanding. We'll continue to work with you during suspense, but all of us know the state is facing a critical financial crisis. And so this year, more than any other time, we're going to be really scrutinizing the numbers. And suggestions like private funds, which may be appealing under some circumstances, when private funds dry up, the general fund is called in to backfill. And so we don't look at private funds any more favorably than we do cost of the general fund now, especially in this climate. So just for everyone's edification, so we're on a level playing field. It's going to be a very tough year. We'll do our best to work with all the authors who are bringing their best work forward in order to deliver programs Californians need. But remember, there's not going to be very much money. All right, so that one, we're going to take more testimony in favor if there is any. Is there any opposition testimony? Finance, do you have a comment?
No, file.
All righty. I have a motion for suspense. It'll go there without objection. And then Senator Alquist, SB 270?
Yes, Madam Chair and members, SB 270 establishes an advisory panel for HIT, Health Information Technology Implementation in California. The Appropriations Committee analysis notes that the panel may cost between $50,000 and $150,000 for the year 2009-10 and more in subsequent years. I might say that one thing that should really make the cost a lot lower is that we anticipate that most of these meetings could take place via teleconference.
Good suggestion.
And there is a great need to do this. Certainly, we need to be implementing HIT in the state of California in a much more significant way, and ask for your support.
Thank you,
and
Senator
I know it's going to
Alquist.
suspense.
I know. I only give that speech once a hearing. And testimony in favor.
Connie Delgado Alvarez with the California Hospital Association. We thank the Senator for bringing this effort so that we can all work on a coordinated effort on this issue. Thank you.
Thank you. Any other testimony in favor? Is there opposition testimony? Finance, do you have a comment?
I do not.
All righty. It goes to suspense without objection. And Senator Alquist, you're going to take up 303?
Yes. Madam Chair and members, nursing home residents are being administered psychotherapeutic drugs, especially a powerful subset called antipsychotic drugs without informed consent. This is an issue I have worked on since 1999 when I had a bill signed into law in 2000 and thought I had fixed the problem. And it turns out that a lot of nursing homes are still giving this medication, which in some cases is causing heart attacks or deaths. I respect the committee's estimate of $140,000 in general fund cost pressure. I believe I'd like to state respectfully 3 reasons why I think SB 303 would not require any general funds, and they would be: number one, nursing homes must already verify their residents' informed consent prior to administration, and there must already be proper training in place. Nursing home members receive monthly in-service trainings. That is already in the law. And finally, nursing homes are currently exceeding their annual cap on Medi-Cal reimbursement, so any additional expenses incurred would not be reimbursed, which means would not be a cost to the state.
Very good. Senator, I see you have quite a bit of testimony. I'll take 3 comments, and then the remainder will just give their name and their position of support or opposed.
Good morning. I'm Anthony Chicotel with California Advocates for Nursing Home Reform, a sponsor of this bill. When I read the fiscal summary, I was a little surprised that there was absolutely no discussion about the fact that most nursing homes are already doing this the correct way. We think a minority of them are not, and it may be a substantial minority, and that's who we're targeting here. But 1,300 facilities having to do new training is absolutely not the case. We also think, to support what Senator Alquist said, that these facilities are already being paid to train their staff 12 times a year. Once a month, they receive in-service trainings on what the latest techniques are regarding quality of care. Informed consent could certainly be covered in-service staff trainings that are already being paid for by Medi-Cal. Additionally, this summary doesn't talk about the potential savings here, in that ultimately fewer psychoactive medications will be dispensed to nursing home residents. They will no longer be over-drugged. And just last week, Governor Schwarzenegger talked about psychoactive drugs as a potential target for saving state expenses because of the growing use of them and their tremendous costs. So we urge your support for SB 303.
Thank you. Next, please.
I'm Senior Assembly Member Lola Young on behalf of the California Senior Legislature, and we also agree with the author that this bill is already being taken care of by most of the nursing homes and that the expense should not be that much, and we fully support this bill.
Thank you. Next.
Gary Passmore, Congress of California Seniors. For all the reasons you've already heard, we're in support.
All righty. Welcome.
Thank you. Joan Parks, representing the 35 local ombudsman programs throughout the state of California who deal with the in-service trainings and help a lot with the in-service trainings dealing with this very issue of informed consent. We fully support this bill.
Thank you.
Madam Chair, members, Bill Powers on behalf of the California Alliance for Retired Americans. Important protections for seniors in nursing homes. We urge your aye vote.
Thank you, Mr. Powers. Next, please.
John Joseph, AARP, on behalf of 3.4 million members of AARP in California. We fully support SB 303. Thank you.
All righty. Thank you.
Whoa. Okay. I need to pull this forward.
Yeah.
Hello, Rick Hodgkins. I'm speaking on behalf of myself. I'm in support of this bill. My father was in a skilled nursing facility here in Sacramento called Flooring Healthcare Center, and he has dementia. And because he was so difficult for them to control and deal with, they put him on psychotherapeutic drugs just so they can control him and deal with him without him making any sound. And as a result, he had lots of complications, like they had to drain his bladder. They had to do all sorts of things just to get him to respond again. Luckily, his blood sugar was okay because he has type 2 diabetes. But I'm in support of the bill because I think we can really get these nursing homes to clean up their act. Thank you.
Thank you very much. Any other testimony in favor? Is there opposition testimony? All righty, we'll wait.
Thank you. Thank you.
All righty. Those in opposition, welcome.
Thank you. Good morning, Madam Chair, members. Dave Helmsen on behalf of the California Association of Health Facilities. Start out by saying we respect what Senator Oplis is trying to do here and her long history of concern. We are happy to help do what we can do, and in fact do that very well. And the Department of Health Services that reviews these facilities, they've issued 7 deficiencies in the last 8 years for not obtaining informed consent. We take it very seriously and are happy to verify that the right physician interaction has occurred with the patient prior to these drugs. The problem is that the requirements in this bill ask us to go beyond what our normal scope is and assess the quality of the physician's interaction with the patient. We have to make sure it was voluntary in terms of informed consent and that they received a certain block of information known as a black box information. These are not things we normally do. They're borderline on nurses' abilities to do these things. We don't prescribe drugs. Okay, we don't treat the patient. We don't decide their course of treatment. But we are happy to do what we can do. This takes us outside of that level and at a minimum will require substantial training of our nurses. We've offered amendments to clarify this. We're willing to verify it, to highlight it in our patient planning process, which involves physicians and pharmacists. We'll do what we can, but the things in this bill we don't think we can do well, and we've asked for amendments. Until they're there, we must continue to oppose the bill. Thank you.
Thank you. Next, please.
Barbara Glazer on behalf of the California Hospital Association. A number of our hospitals operate skilled nursing facilities as distinct parts of the hospital, and for the same reasons as CAP, we are opposed to the bill. We do, in part, the bill simply takes regulation and puts it into the law. We're fine with that aspect, but there is that new component that will require us to train our folks in a new way, in a different way, and we don't think this is necessary.
Next, please.
Jack Christie for Aging Services of California. We represent not-for-profit providers of affordable housing, assisted living, and skilled nursing. We also oppose this bill. We think that the scrambling between the physician's scope of work and the nurse's scope of work complicates this bill too much for us to be able to support.
Any other opposition testimony? Finance, do you have a comment?
No.
Members, this is a candidate for suspense. Without objection, we will move 303 to suspense. Senator Alquist, your last item is SB 687.
Yes. HAI, Healthcare Associated Infections. SB 687 creates only 2 new requirements for long-term care facilities, and that is number 1, to see that staff training occurs on health care associated infections annually or as needed, and that facilities keep a record of the infections. That is all that this bill does.
Thank you very much. And is there testimony in favor?
Again, good morning. Tony Chicotel with California Advocates for Nursing Home Reform. It's pretty much the same as SB 303. Nursing homes are already required to provide in-service staff trainings once a month to all of their CNAs. Nurses are required to have continuing education, and we think that this could be made part of that without any new costs.
Senator Cox?
Senator, the thing that occurs to me here is that if a person is moved out of a nursing home for an infection, and let's say they have, just for the sake of argument, they have 6 beds that are in isolation, and they use them for separating the folks who are there who have an infection. One of those goes to an acute care hospital. And so now, all of a sudden, you've gone from 6 to 5. But in the meantime, while this person's in the hospital, in the meantime, a person comes back, or also gets an infection. And so now all of those 6 beds are full. The person who's gone to the acute care hospital comes back, and my question to you is, what happens with respect to that 7th patient who comes back, who rightfully has the opportunity to be at that nursing home, and yet it's beyond their capacity? What happens in that situation?
If it's within 7 days, the person has to be taken back.
Well, let me ask the question. Maybe I didn't make it clear. Let's say if it's within 8 days, they don't have to take him back. But if they have to take him back within 7 days,
right.
If they come back on the 6th day, let me just wait till he...
Well, we're talking about certain specific infections like tuberculosis.
Yes, ma'am.
Some would not qualify. If it's within 7 days, they have to take them back. If it's 8 or more, they don't.
Yes, ma'am.
Is that answer
Well,
the question?
I thought I understood that's the case, but my question is, what happens in the meantime if they fill up those beds and they had a capacity for 6 to begin with, one of them moved out, and then someone else moved in, met the qualifications, and now all of a sudden they come back within a 7-day period of time?
Well, they have to hold the bed for 7 days for this very specific kind of...
Vacant?
Yes.
Without earning any income on that bed?
Well, the person has to have some place to go.
I understand that.
And he or she acquired the infection probably there, and the bed should be held. Where's the that's existing law.
And Senator, if the resident's private pay, they have to pay for the bed to be held for those 7 days. If they're on Medi-Cal, Medi-Cal will pay for that bed hold.
We, meaning the state of California?
Right.
I see. Okay.
That's currently the law.
Okay, Madam. Thank you, Madam Senator. Thank you. Thank you.
Is there more testimony in favor?
Senior Assembly Member Lola Young with the California Senior Legislature, and we are in support of this bill.
Thank you. Any other testimony in favor? Is there opposition testimony? Senator Alquist, do you have a comment?
I just like to, I wanted to be clear in terms of Senator Cox's question. It is already law about the 7-day hold. I am not doing anything on that point. That is law already.
I understood
that is not in this bill.
I understood that point.
Thank you.
I'm just trying to figure out what the establishment does in order to stay in business and in order to accommodate.
Well, it's been financially, it is covered in the 2 ways that the witness mentioned.
We'll take opposition testimony now.
Jack Christie for Aging Services of California. We oppose this bill because it puts nursing homes in the position of having to decide which orders they're going to follow, this bill or the current restrictions on taking some patients back that come back to the nursing home with certain infections. This bill puts them in the position of having to choose which law they want to follow. We oppose.
All righty. Finance, do you have a comment? Nothing from Finance. Again, members, this is a candidate for suspense, and we'll move it there without objection.
Thank you very much.
Thank you, Senator Alquist. Let's see. Our Senator Liu is next. Presenting one bill, Senator Liu? Two. All right. Tell me which. SB 110.
And SB 391. I'm waiving presentation on SB 118.
All right. Go right ahead.
Thank you, Madam Chair, members. SB 110 addresses the problems of crimes against elders and people with disabilities. Research shows that crimes against these individuals are widespread, and we can improve our efforts to prevent, report, investigate, and prosecute. The bill includes a variety of provisions. Individually, these make incremental progress. Together, they make a strong statement, as the budget allows, about society's commitment to protecting these vulnerable individuals. SB 110 is a candidate for suspense today, and there is extensive support for this bill. I have witnesses who will briefly summarize their support.
Thank you, Senator. I see a number of witnesses. We'll take comments from three, and then the remainder will do their name and their position. Right ahead.
Greg DeGier, representing the ARC of California, the state's largest organization representing people with developmental disabilities and their families. We're the sponsor of the bill. I'll just say that the people with disabilities are subject to a much higher level of crime than the general population. It's most of their classes of victims, we wouldn't stand for it. This bill makes incremental progress towards solving that problem, and we're eager to work with your staff on the cost concerns.
Thank you very much. Next, please. Welcome.
Thanks. Joe Manis, the Executive Director of People First of California, the owner group run by and for people with developmental disabilities. We strongly support this bill because we know how important it is out there to have something to protect us. Thank you.
Thank you. Next, please.
All right, Senator Kehoe, it's Rick Hodgkins again. I'm speaking not only on behalf of myself, but on behalf of Capital People First, who I'm a member of. I'm in support of this bill. I used to be a student at the California School for the Blind, and there's a lot of mental and psychological abuse of blind students there, so I think that this bill will help them. Thank you very much.
Thank you.
Gary Passmore, Congress of California Seniors, and we're in strong support of this bill.
Very good. Next, please.
Senior Assembly Member Lola Young on behalf of the California Senior Legislature, and we're in strong support of this bill.
Thank you very much. And I think we have some more testimony. We'll wait. Okay.
Good morning. My name is Karen Tokash. I'm with California Church Impact, and we strongly urge you to pass this bill. We support it strongly. Thank you.
Thank you. Mr. Powers?
Bill Powers, California Alliance for Retired Americans, also in strong support.
Thank you very much.
Brandon Tartaglia with Disability Rights California. We strongly support the bill. Thank you.
Very good.
Dawn Kepke on behalf of Crime Victims United of California and the Child Abuse Prevention Center, both in strong support.
Thank you.
Beth McGovern on behalf of the California Commission on the Status of Women, in strong support.
Thank you.
Charlotte Newhart with the California Independent Living Centers, in strong support.
Very good. Is there any additional testimony in favor? Is there opposition testimony to SB 110? Yeah. Any opposition? Finance, do you have a comment? All righty, Senator Liu, this will go to suspense without objection.
Thank you very much.
And then you're waiving presentation on
118.
SB 118, so we'll take that up at the end of the file. And now you'll do SB 391.
Yes, Madam Chair, members, I asked for your aye vote today on SB 391. This bill would require updates of the California Transportation Plan to address how the state will meet its transportation infrastructure and mobility needs while also meeting air pollution standards and reducing greenhouse gas emissions in accordance with AB 32 Pavley, Executive Order S305, and SB 375 Steinberg. In preparing the CTP, Caltrans would consult with other state agencies and departments, regional entities, the cities and counties associations, and the public. The plan would be updated every 5 years. Members, this bill aligns with California's new direction away from single-purpose planning and regulation and toward integrated processes that recognize the relationships among land use, transportation, housing, air quality, and resource use.
Fundamental to the shift are coordination among local, regional, and state governments and public involvement at all levels. AB 32 of 2006 and SB 375 and SB 732 of 2008 have accelerated this shift. SB 391 is an effort to fit another piece of the puzzle into an integrated statewide planning process that will secure a sustainable future for California. I understand the cost of this bill fall under the threshold and will be paid out of federal funds, and I ask for your support today.
Thank you, Senator. Is there testimony in favor? This is a due pass, members. Is there opposition testimony? Senator Cox, then we'll go to finance.
Thank you, Madam Chair. Let me just ask. I want to be certain because I want to advise our caucus members. Will it be the policy from here on that we will take study bills and spread their cost over a specific period of time? For example, one of the arguments that's made in the Democrat proposal analysis is that the cost would be spread over multiple fiscal years between the end of 2010 and 2015. And so I want to know, so I can advise our caucus members, is this the process that the Appropriations Committee will take hereafter, I guess as long as you're the chair, Senator Keogh? So I just want to get some understanding about the consistency.
Well, we'll certainly strive for consistency.
And will this be the rule then, ma'am?
It will be the rule.
Okay.
If we have changes, I'll discuss them with you ahead of time, but I'm not anticipating that.
Okay. Thank you very much.
If we have the length of time that the bill is covering, it's reasonable to spread it out over those years. And we'll do the same on all bills.
Just want to advise our caucus as to I'm not sure there's a change in the rules, but just want to be sure that they know what the process and the procedure is consistent.
Very good.
Thank you, ma'am.
You're quite welcome. And we were taking opposition testimony, if any. Finance, do you have a comment? Senator Leno moves the bill do pass. Will you call the roll, please?
Kehoe?
Aye.
Kehoe, aye. Cox?
Aye.
Cox, aye. Corbett? Corbett, aye. Denham? DeSaulnier? DeSaulnier, aye. Hancock? Leno? Leno, aye. Oropeza? Runner? Walters? No. Walters, no. Wolk? Wolk, aye. Wyland? Yee? Yee, aye. Denham,
Cox, I don't know. I'm sorry.
Cox, I don't know.
Cox, I don't know. 6-3. We need one more.
6-3, and we'll keep that open.
Thank you, Madam Chair.
Thank you. Senator Lowenthal? One item, SB 193. Then we'll go to you.
Madam Chair and members, the Avalon School on Catalina Island is in the Long Beach Unified School District. It's a K-12 school of approximately 700 students. In May of 2007, a major fire destroyed all of the vegetation on all the major canyons that drain into the valley, which contains the school site directly, and then later on it comes into the community itself. Whenever the ground reaches a saturation level, there is imminent danger now of mudslides and rock slides, which could result in extended closures or evacuations of the school. What SB 193 allows is a waiver to class size reduction penalties only in situations where there's first a major rain event, where the mainland schools have to absorb Avalon school pupils. You know Avalon is 26 miles from the mainland. It's the only large school on the island. And where K through 3 class size reduction limits would be exceeded in those other schools now because they now have to do this influx of students. In 2008, AB 1893 of Garrick in the statutes of 2008 was approved for other districts that were affected by the fires in October of 2007. We are asking for similar consideration for the Avalon School, and I realize this bill does go to suspense.
Thank you, Senator Lowenthal. Testimony in favor?
Yes.
Go right ahead.
Susan Stewart, Madam Chair and members. The amount stated in the CDE analysis is based on a calculation that far exceeds anything that would ever happen. The district's maximum calculation would be less than 20% of that. The costs listed in the bill are not new costs that would result in costs to the state, but as Senator Lowenthal said, it is basically allowing the state not to assess a penalty on a district in the event of closures of a school. And we ask for your aye vote.
Thank you. Any other testimony in favor? Is there any opposition testimony? Finance, do you have a comment? This will go to suspense without objection. Thank you, Senator Lowenthal.
Thank you.
We'll work with you on it then.
Thank you.
Senator Duchesne, I think you are next. 5 items, starting with SB 51, Salton Sea Restoration Council. This is a candidate for...
One quick bill.
He's got one. Okay, fine. Senator Benoit, you're presenting for Senator Padilla.
I am, and I was just writing you a note, but thank you very much. We'll make it very brief. SB 712, 211 lead agency. Madam Chair, members, SB 712 will position California for its fair share of federal dollars to help build out the state's 211 system. I understand the bill is a suspense candidate. However, the federal government is expected to appropriate millions of dollars to California and other states to build out the 211 system. SB 712 will operate contingent on the receipt of those federal funds. While this is a suspense item, I'm happy to clarify the 211 service brings significant benefit to Californians. It's a free service for the caller that helps them direct to not only government agencies but many nonprofit agencies who can provide help in the community, which is obviously clearly needed at this time. It's had terrific benefit in areas such as where there were huge fires in the San Diego area last year. The system operates there. It is not operating in other places. Currently, 21 of 58 counties have 211 access. We need to bring California law into compliance by setting up a state agency with oversight responsibility to thereby meet the federal requirements to draw down federal funds for this purpose. Testifying briefly this morning in support of the bill is Pete Manzo from the United Ways of California. He's the CEO, and Maribel Marin representing the California Alliance of Information and Referral Services. Pete, please.
Very good. Senator Benoit, the federal funds require a match. What's the proposal on coming up with the match, which would be the state's responsibility, as I understand it?
Could one of you address that?
Certainly. Good morning. Right, currently the 211s that are operating raise about $18 million a year. That money can be used for match, and we've been operating since 2005 as 211s, but we've also been operating as INRs for many decades.
And the 211s down in San Diego County, what's the source of funding there? The first 5?
First 5 is one funder. There are across the state funders from all sectors. So First 5 is one of our funders, along with various other sources.
Okay, thank you. Go ahead.
Good morning. I'm Pete Manzo, President and CEO of United Ways of California, and we'd like to thank Senator Keogh and the committee for hearing us this morning. United Ways is comprised of 37 local United Ways around the state. And collectively, we raise and give away over $200 million a year. We're one of the largest philanthropic organizations in the state. And we take very seriously what we choose to get behind. And we've been supporters of 211 for over 2 decades now. We've seen firsthand how well 211 supports local communities. 211 connects people in need from all walks of life with vital information and links to resources that help them take care of their families and communities. It not only meets these critical needs, but it does it in an extremely cost-effective way. People who reach 211 do not hear a recording, but speak live with a well-trained professional specialist who can deliver high-quality service in their language. 211 Los Angeles, for example, can answer calls in over 70 languages. So this is the same efficient service we would like to see brought to all of California's 58 counties. And United Ways of California and California Alliance of Information and Referral Services are committed to extending 211 coverage to all Californians, enhancing coordination among local 211 providers, and building a 21st century infrastructure to support this vital service.
Very good. Thank you. Next, please.
Good morning. Good morning. I'm Maribel Marin. I'm the Executive Director of 211 LA County, but I'm also here representing 211 California as its co-chair. I just want to follow on to what Senator Benoit mentioned earlier about this bill allowing California to draw down matching funds for the dollars that we've been raising thus far and allowing us to expand our services across the state by bringing these federal match dollars to the state.
Very good. Next, please.
I'm Nancy Findyson with the Community Services Planning.
And there's other people to testify, so if you... Yeah. Thank you. Then they can be seated.
Nancy Findyson, Community Services Planning Council. We operate 211 in Sacramento County. We also are working with Nevada, Placer, Yolo, El Dorado counties to bring 211 to our region. We're in strong support. I'm also here to present a letter to the committee from Chief Rick Martinez, who's the Chief of the Emergency Operations Office in Sacramento County, who also urges support for the bill. And I can say that in Sacramento County, we have 8 different funding sources that can be used as match. First 5 is just one.
Very good. And now the remainder of the testimony, just your name and your position on the bill.
My name is Ed Schoenberger. I'm the Executive Director of 211 in the Bay Area, which serves 5 separate Bay Area counties, and we strongly urge support of the bill.
Thank you. Nick.
Kelly Brooks on behalf of the California State Association of Counties. We're also in support.
Thank you.
Khadija Alam on behalf of the Advancement Project in support.
Very good.
Don Shinsky on behalf of the American Academy of Pediatrics California chapter in support.
Thank you.
Vic Guzman on behalf of California Alliance for Retired Americans. We are in support.
Thank you very much.
Cindy Hillary, Regional Council of Rural Counties, in support.
Very good. Any other testimony in favor? Is there opposition testimony? Finance, you have a comment?
This bill would, Miriam Inchinito with the Department of Finance, this bill would require Health and Human Services Agency to undertake various planning, administrative, fiscal, and reporting functions, but the bill's implementation is not subject to the availability of the federal funds that folks have referenced. HHSA estimates significant costs to implement and manage a statewide 211 information system, and we believe that the bill could be amended to require its implementation contingent on those federal funds.
Thank you. This will go to suspense without objection. All righty. Thank you, Senator Benoit.
Thank you, Madam.
Senator Pavley, you just have one item, too. Do you want to? Okay, go. All right. Then we will go to Senator Ducheney.
I let 2 go. It was already my turn.
SB 51, Salt and Sea.
Thank you very much. Appreciate Senator Pavley's patience, and hopefully we can both get out of here before we start session at noon. Thank you very much, Madam Chair and members. SB 51, that some of you have heard in Policy Committee, the Salt and Sea Restoration Council, is our attempt, as we did last year, to provide a long-term governance structure for the sea. We understand the concern that the committee has, and we're happy to work with you while the bill is on suspense. We do not think the ongoing and annual costs, and certainly over the next few years, are very high. I understand the concern about long-range pressure, and we are in this sort of catch-22, members. We are legally responsible for restoration work at the sea because of the quantification settlement agreement that the state was a party to in 2003. And we do have some obligations. We have gone through a process. We have developed a plan. We need the ability for that plan to be implemented going forward. If we specify a plan, folks say, but you're committing us to long-range costs. If we don't, we have issues getting the federal government and local governments to contribute. So we're trying to find that balance. We don't need to be wed to a specific plan. That's why we want a governance body that can look at new data, at science as it comes along, all of those things, but we also need that to be an entity that can receive federal funding, that can coordinate with local governments for local funding. This is not intended, and never was, to be a state-only responsibility. It cannot be, and it will not be. There is local money committed, there is federal money committed, and if we can show a commitment that we are moving forward on restoration, that I think this bill would provide, then more federal money will, and possibly other nonprofit monies would become available to us. So we're happy to work with the committee as we move forward.
Testimony in favor?
Bob Ham, County of Imperial.
Right, on the finances?
Just quick.
Yeah, this is just very, very important to us. If it doesn't get done, there are going to be some air quality implications that could be even more expensive. So we just want to see this moving forward.
Okay, very good. Any other testimony in favor? Is there opposition testimony? All righty. Finance, do you have a comment?
Proposition 84 provided $47 million for transfer to the Salton Sea Restoration Fund to fund the restoration projects. $29.4 million of these funds have already been appropriated. The fund also receives contributions from local water agencies. However, these agencies have only provided $167,000 in 7-8 and $172,000 in 8-9. The preferred alternative for the Salton Sea restoration, released by the Secretary in May 2007, estimated a cost of $9 billion over 75 years. The Department of Water Resources estimates costs to be $509 million to implement period 1 of the preferred alternative, and the no-action alternative requires air quality and endangered species mitigation to meet the state's minimum obligations under the QSA, and would cost an estimated $900 million over 75 years. This bill does not include a long-term funding plan for the Salton Sea restoration efforts. The Department of Fish and Game estimates costs of $514,000 to fund 5 positions.
All righty. This is a candidate for suspense, members. Without, is there a question?
I can just one comment. There are bond funds. There is some of the local money becomes available at a certain point in time based on the QSA.
Very good. This is a candidate for suspense. Without objection, it'll go to suspense.
Thank you very much.
We'll work with you on it that time, Senator
Thank you very
Cheney.
much.
All right. SB 271, also a candidate for suspense.
Yes, appreciate that, Madam Chair and members. This is our effort to think about the long-term needs of the state for higher education bonds. Higher education has been without capital authority now for some years, and we attempt to do 2 new things. One is to give ability for them to do off-site infrastructure projects that may be necessary based on some court decisions and some issues that have happened in a lot of communities, the ability for them to use some money off-site to do infrastructure necessary to a given campus may be appropriate, and the other is to encourage joint use facilities. We understand pressures and concerns, but we think in 2010 may be the right time to offer up another higher education bond. Ask for your off suspense.
Testimony in favor?
Madam Chair and members, Steve Juarez on behalf of the University of California. The university is strongly in support of SB 271. We want to thank the author and her staff for working closely with the higher education segments on this proposal. We believe that it is critical that we have a measure before the voters during the 2010 cycle to meet both the capacity needs of our growing campuses as well as the infrastructure and the seismic and rehabilitation needs of our established campuses. We also believe that the work that's surrounding these particular projects, which we believe will be shovel-ready by the time the measure is passed, will be a critical component in bringing back the economy for the state of California. For every $100 million that's invested in these types of projects, we are able to generate about 3,400 quality jobs. So we believe in this as a matter of stimulus.
Next, please.
Good morning. Wes Larson, California State University. Our GEO bonds are our only source of capital improvement funds. Our need is a little over, our 5-year need is $6.5 billion. That equates to about $1.6 billion a year. This bond provides $550 million. We ask for your aye vote.
Thank you. Next, please.
Members of the committee, I'm Mike McGee with California Community Colleges.
And we need a chair there, gentlemen, yeah.
We serve over 75% of the public undergraduate students, and we need this bond to help serve our students. The bond measure is about half of what we need, but we understand the fiscal condition and the fact that this measure, if implemented, will help stimulate the economy and growth in our jobs. Thank you.
Very good. Next, please.
Madam Chair, Bonnie Slauson representing the Community College League. On behalf of our 72 districts and 110 colleges and our almost 3 million students, this bill is very critically needed to be able to provide educational facilities for our students. Thank you.
Thank you. Any other testimony in favor? Is there opposition? Then Finance, do you have a comment?
I don't have a file on this measure, but for the committee's benefit, the 2009-10 budget includes $5.9 billion in debt service, which represents about 6% of the general fund. And to the extent that already authorized bonds are sold, that number will increase, and the percentage of the general fund is also dependent on the amount of general fund that's available and that percentage will increase likely as general funds decrease.
Very good. This is a candidate for suspense, so without objection, SB 271 goes to suspense. Senator Duchesne, you're going to take up 310?
310, yes.
And this is, there's some amendments to be discussed here.
Yeah, we would be happy to take the committee's suggested amendment on page 1 of the analysis as an author's amendment, helping to narrow the costs and ensuring that they would and making those costs to the regional boards minimal. This is an effort, members, to deal with an ongoing problem in many areas of the state, stormwater regulation. In many areas, it's neither effective or equitable. It tends to charge that who you can find and new development and without having a plan that acknowledges existing infrastructure and stormwater runoff that occurs in older communities and in existing areas. We think the approach of an integrated regional stormwater management plan is a way to look at this. We have offered it as a voluntary here, not mandatory, but that areas who want to do that, regions who are prepared to move forward that could do so in cooperation with their regional water quality control boards, and allows the permittees to develop that improvement plan, to pay for that improvement plan, and to make it work as an integrated model similar to what we've done with integrated regional water plans. Ask for your vote.
Thank you. Testimony in favor?
Madam Chair, members, Ed Manning on behalf of the California Major Builders Council, or sponsor of the bill. This bill attempts to provide a framework for watershed planning that has been recommended by the National Academy of Sciences. It actually provides pretty detailed requirements of what needs to be in the plan, and then the plan, once approved by the regional board, would give the ability to impose fees on those contributing to the pollution in the watershed. We think it provides an alternative compliance mechanism, which will be important, and we strongly support the bill.
Thank you. Senator Runner, I think, has a comment.
Sure.
Go ahead. Testimony.
Good morning, Madam Chairman and members. Steve Cruz of the California Building Industry Association. As Mr. Manning stated, we think the tools created by SB 310 in terms of creating a voluntary mechanism to develop watershed improvement plans that look at improving water quality across the entire watershed will be valuable and go a long ways towards improving water quality in California.
Very good. Additional testimony? Is this in favor?
Madam Chair, Andy Fields of California Alliance for Jobs. We have not signed on as an official favor of the bill, but once our board votes on it, I do believe we will. Thank you.
Thank you. Senator Reddick?
Just a question. I guess the issue that is troublesome to me, I have specifically in an area, I live in an area, a lot of development has taken place attached to older development that's already there, all within the same watershed. And so obviously some of the problem that's occurred is that as the new developments take place, they're responsible for watershed planning within their area. The problem is it just runs right off into existing older areas, and then therefore that ends up being a problem. There's been several attempts to try to create some kind of a flood management district or something within that area to try to alleviate that. It just has not been successful. Let me see if I get this scenario right. In this development, that there would be somehow a planned development that would happen in one section of the watershed, but the ability then is to try to create a plan for that whole watershed, and then that would be presented. And then if that plan was accepted by that whole watershed, or that whole plan was accepted for that whole watershed, that there would be the ability to put fees on those not only developing the new, but all those who were already living in the existing watershed. Is that correct?
No, not exactly.
Okay, because I keep hearing this issue of voluntary, involuntary.
Well, first of all, the requirements go on MS4 permittees, and those are municipal stormwater permittees, and they're usually cities or counties or flood control districts.
Yeah.
And they have a legal responsibility to deal with stormwater.
Right.
To the extent that they had a legal responsibility to deal with stormwater in a particular watershed, then the MS4 permittee could put together the watershed implementation plan. And as part of that, they would have to look at the flows, they'd have to look at the contaminants of concern. And the extent of the fee authority, Senator Runner, would be only as to the flows and contaminants of concern coming from certain places through certain activities.
Whether or not, though, that they were a part of the original plan put together. A fee would be established on people within the existing watershed if they met that criteria.
That's correct. And then we discussed this. If they met the criteria, they could be assessed a fee. The way current law, the only mechanism in current law that exists right now is to impose pretty severe restrictions on new construction with no way of dealing with the built-out environment. That's the problem with watershed planning right now.
Or go to that whole area and ask them to go ahead and put together their own plan and have everybody participate.
That's correct. That's correct. And that's what the MS4 permit.
So just to clarify, because I keep hearing this word voluntary, this could result in somebody being assessed a fee involuntarily in this process.
Well,
yes.
Okay.
Yes, it could.
An individual within an area who's currently not contributing to support the stormwater management of their area.
Right. They've lived in this area for the last 25 years,
and they may have been contributing to the stormwater problem throughout that time with no contribution to it because they weren't a new development in the period in which only new developments were pushed to deal with the stormwater issue.
Yeah. Okay, thank you.
First, we're being asked to go to the floor, which we'll do after we conclude this bill. So, Senator Runner, if you have any more. No, I'm fine. All right. Is there any more testimony in favor? Is there opposition testimony? Finance, do you have a comment?
We estimate that it would cost $260,000 to the Waste Discharge Permit Fund, and that there's no mechanism in the bill for which the regional boards could be reimbursed for this activity.
I think the amendments took care of that issue.
I will.
The amendments deal with that issue, I think.
We'll take a motion.
Move as amended.
Do pass as amended, then, members. If there's no more questions, call the roll, please.
Kehoe?
Aye.
Kehoe, aye. Cox? Cox, no. Corbett? Corbett, aye. Denham? No. Denham, no. DeSaunier? Aye. DeSaunier, aye. Hancock? Aye. Hancock, aye. Leno? Aye. Leno, aye. Oropatha? Runner? No. Runner, no. Walters? No. Walters, no. Wolk? Aye. Wolk, aye. Wyland? Yee? Yee, aye.
We'll keep
7 to 4.
7 to 4. We'll keep it open.
Thank you very much.
We're in recess, members. We'll resume with you after session.